Bisexual Health Awareness Month was first launched in March 2014 by the Bisexual Resource Center. It was established to address the significant physical and mental health disparities that bisexual individuals face compared to their gay, lesbian, and straight counterparts. It raises awareness about the bisexual community's social, economic, and health disparities, advocates for resources, and inspires actions to improve bi+ people's well-being. The campaign began as a social media pilot titled, "By the Way, Our Health Matters Too." It was one of the first national initiatives focused specifically on bisexual health inequities. While the observance began in the US, the disparities it highlights are also reflected in Canadian research. The month was created after researchers began separating bisexual data from broader 2S LGBTQIA+ statistics, revealing that bi+ people, the largest segment of the LGBTQ+ community, often experience higher rates of depression, suicidality, cancer, and substance abuse. Over the last decade, the observance has grown into a major annual event supported by national organizations like the Human Rights Campaign, HRC, and PFLAG. The theme for Bisexual Health Awareness Month in 2026 is claiming the right to care as bi+ people. The 2026 campaign focuses on the principle that bisexual individuals are entitled to competent, affirming, and accessible healthcare. The theme aims to address systemic barriers where bi+ people often feel forced to justify their identities or accept inadequate treatment due to persistent biphobia and provider misunderstanding. Claiming the right to care as bi+ people affirms a core principle. Bi+ people are entitled to competent, affirming, and accessible healthcare without having to justify their identities, minimize their needs, or accept inadequate treatment. Bi+ people experience disproportionately high rates of mental health challenges, substance use disorders, chronic stress, and healthcare avoidance, driven by persistent biphobia, erasure, and a lack of provider understanding. Many bi+ individuals report being misunderstood, dismissed, or forced to self-advocate in healthcare systems that were not designed with their experiences in mind. These barriers are compounded for bi+ people who are neurodivergent, disabled, trans, people of color, or otherwise multiply marginalized. As we move through Bi+ Awareness Month, we're reminded that visibility isn't a single moment, but an ongoing practice of showing up for ourselves and each other. This month invites us to deepen the conversations already underway, challenge the myths that persist, and celebrate the full spectrum of bi+, pan, fluid, and queer experiences. There's still time to amplify stories, uplift community, and make space for the complexity that defines us. And every day we do, we strengthen a future where bi+ people are seen, believed, and valued.